So, what are the symptoms of esophageal cancer? There are several key symptoms for people to be aware of, and if they do experience them, we would encourage patients to see their GP or seek medical attention urgently. But bear in mind that not every symptom can be cancer-related. Having said that, irrespective of your symptoms, most people, or about half of people, will end up having a chronic illness diagnosis because of those symptoms. Though they may not necessarily be cancer, they may still require follow-up. So I'm now going to run through the symptoms that are most commonly associated with esophageal cancer. The first and most important is difficulty in swallowing. Most people will describe food getting stuck as they swallow their food. Sometimes it's difficulty in swallowing certain types of foods, like solid food, or what we describe as stickier foods like bread or pastry. Sometimes it's easy to swallow water rather than solid food. Sometimes swallowing can be painful. People can describe swallowing the food and then feeling a pain in the chest or lower abdomen. Sometimes people will feel that they have a regurgitation of the food, so it may not necessarily feel like it's getting stuck or painful, but food is regurgitated quite soon after eating. Persistent heartburn or reflux is an important symptom to be aware of. This is very common, and many patients will report these to the GP without being aware that persistent heartburn and reflux, particularly symptoms that are not getting better with simple methods, can be a sign of cancer. Another very important symptom that can be very vague is unexplained weight loss. This is something that many patients describe, and it's reported that up to 80% of patients with esophageal, gastric and upper gastrointestinal cancer may present with. It can be quite subtle, and it's something that people don't really think about until they realize their clothes are a bit looser, or their friends or relatives might describe that they've lost some weight. The final symptom that's quite important to bear in mind is a change in voice. There's a nerve that runs in the middle of the chest, near where the esophagus or food pipe is, and if it is disturbed by a cancer mass, it can cause a change in the voice, and some patients describe it as a hoarse voice or difficulty in projecting their voice. So these are the common symptoms to look out for. So that's difficulty in swallowing, pain when you swallow, unexplained weight loss, reflux or regurgitation of food, heartburn, particularly heartburn that's resistant to treatment, and a hoarse voice.